Hi everyone, it's Wynn Brown with Heywood Healthcare's weekly update for Friday, February 25th. Snowy day out there. I hope everybody's safe on the roads and taking all the precautions you need to make sure that you get to and from work safely. Hard to believe that next week we'll roll into March. Spring is not far away, hopefully. Just an update on our COVID-19 testing and community prevalence. We've tested a little over 148,000 specimens so far. Our positive test rate throughout the pandemic is at 9.2, more than twice the state at 4.1%. Pleased to see our 7-day rolling average is down to 8.25%, but still about 4 times the state average at 2.44. We've got 10 COVID positive patients at Heywood Healthcare as of this broadcast today. Our community average is 29 per 100,000, which is down 17 points and not that far above the state average at 23.9. So we've definitely come down dramatically from the peaks where we were seeing very high numbers. There's a great graph here for you to see the incident rate dropping. And let's hope it stays down. I'm a little nervous going into school vacation and the dropping of mask mandates that could give us a surge after the kids come back from vacation. So please be careful out there. Even though mask mandates are dropping, I still encourage you to wear masks inside when you're going to different places. We had a fun Stepping Out for Service Star Award on Wednesday. We honored Cheryl Lee Lombardi, who's a lab tech, and thanked her for a job well done and surprised her with a certificate, cake, flowers, and pictures with her colleagues. And so that was a lot of fun. Congratulations to her. Shortly, you'll see her picture in the Heywood Hospital hallway outside the cafeteria, up for 12 months with all the other recipients. There have been some questions about our new $18 per hour base minimum wage. As I reported earlier, when we went to that base 18 minimum wage, and I think our minimum wage at the time was about $15.25, $15.50. We talked about the fact that there would be some compression. So new people arrive and they make $18 an hour, and maybe you've been here several years and you're making about the same amount of money. And I told you, everybody, that we needed some time to address that compression. It's not just a simple thing of just changing everything. You've got to adjust by years and make sure that it's fair moving forward. So we have adjusted and addressed the compression for the LPNs at Athol effective February 13th. CNAs, nursing assistants, CCT techs, CC techs, and OB techs will be adjusted effective March 20th. So we'll address those people who have been here longer tenured to adjust their salary upwards into our new scale. And then for the practices, medical assistants and office assistants will be adjusted the week of March 27th. Also on the backside, it takes a lot of work for finance and for payroll staff to make these adjustments. They're all manual. This is totally affecting over 400 staff in our system. So it's a lot of work in addition to the day-to-day. And you might recall it was just a couple weeks ago we were doing manual payroll. So we're still catching up on a lot of those things. And so next up on the schedule to adjust for compression are EVS staff, food services, and patient registration. So they'll be in the next queue coming up shortly after all the others. So please know that we have not forgotten about it, and HR, among recruiting and hiring and all sorts of other things, and along with finance, we're working on those things. So please know that we have not forgotten about it. One thing I did forget about last week is failed to mention that it was a cardiology recognition week. And so a shout out to our great cardiology staff for their great work. I'm sorry I forgot to mention you last week. Just a little oversight on my part. And just today, our shuttle has been out for service and needs a part that wasn't readily available, so we didn't have shuttle service during the snowstorm today, so I hope everybody was careful, and I apologize about that. Should be back shortly. Speaking of the shuttle and parking, you've seen fencing, construction fencing going up around the south side of the campus on Woodland Avenue. And that is as we are beginning to do the site work for the new surgical pavilion and the associated parking on the south side. And so you're going to see activity. It's already started, but you're going to see even more starting next week. So that is our parking on the south side of campus is going to become affected right around March 27th. And so and it's going to be disrupted for 4 to 6 months until we incrementally can get some parking back once we get some of the parking lot work done. So that means that staff will be allowed to park on Green Street. We've worked with the city on that, and we have also set up a shuttle service that will run from Mount Wachusett Community College during that time period. So just to want to let you know that we're doing that. We're also speaking to the town to see if we can open up Matthews Street for parking as well, but we have not really got that deep in that conversation yet. So we'll be giving you more communication, but the heads up is in about a month, we're going to lose our south side parking for all staff. And that also means medical staff as well. So there will be no designated medical staff parking on the campus other than some spots for our OBs, and pediatricians who come from off-site that need to get there quickly, and some specialists that move back and forth. But overall, 98% of the medical staff will have to park like everybody else in employee parking. So just a heads up on that. I know that that might be a little disappointment, but it's all for the good of progress in our organization. So I appreciate everybody's understanding of that. Just also, we changed our visitor policy this week. So every patient who's not on precautions can have one healthy visitor at a time. And this also applies for patients coming for outpatient visits and services as well. So we're happy to have that back. You still have to go through screening, and please pay attention to the screeners if you're one coming in on site, because you got to put your mask on. You've got to gel in, gel out, or foam in, as we do at our organization. And also visitors have to do that as well. And just remember that the booster shot documentation for employee health here needs to be done by March 4th. For all of our Heywood Healthcare employees, unless there's a reason that you've been allowed to wait longer. Perhaps you had COVID and you want a little bit more time before the shot. So just a thank you to everybody for great work this week, also coming in during the storm and serving everyone as we continue our journey to be one of the best community health systems in America. Have a great weekend.